I'm Katie Collins, speech language pathologist. I worked here at Mertu Medical Center for about 6 years.
I'm Edie Shetler, and I too am a speech therapist here in the rehab department, and I've been here for approximately 5 years. Been a speech therapist for over 15 years.
Here at Mertu for speech and language pathology, Edie and I work across the age span from birth to geriatric. We treat a number of diagnoses from autism or stroke, voice patients, fluency patients. We kind of treat a whole gamut of disorders.
Patients with CP, patients with neurological disorders like Parkinson's and Lou Gehrig's disease. So let me talk a little bit more about specifically our speech therapy department here. Katie mentioned that we work with a wide variety of patients, and we do. The really neat thing that we provide is we get to work with adults down to birth, or vice versa, and it makes for a fun job. And we have a pediatric therapy room here, and it's really fun to bring in the kids and work with them. And there again, we get to see a lot of variety even within the kids. With the autism spectrum diagnosis increasing daily, it seems, a lot of our caseload has to do with autistic kids and really helping them with social disorders and just really dealing with language in general. But along with other things, working with kids with CP, helping them learn to eat, helping them learn to speak and use communication to get their wants and needs met. So, as well as the adult population we serve, we deal a lot with swallowing concerns for the adult population, which is kind of a side thing for speech therapy, really, but it's a large portion of our adult population clientele. And as people begin to age, they begin to have problems with swallowing. So we jump in and help them learn to eat more safely, and a lot of times change their diet and help them so that they can continue to eat and do what they need to do to stay healthy.
With our adults too, we're looking at some program building to really help them, especially with the swallowing. Edie and I are both looking to train in vital stim therapy, so we're hoping that will really help our dysphagia patients. And we're also starting our Lee Silverman voice therapy program, so we're excited about those two things to kind of branch into our adult population a little more.
One of the questions we get a lot is if a child is getting speech therapy services in the school setting, can they still get speech therapy services from us?
Yes, and the answer is definitely yes. They can receive both, and we like to work with their school therapist so that we're kind of addressing the same sort of things. We're on the same kind of page with their school therapist, so that's a great way to deal with the child population, I think. So we get them in various environments and can work with their school therapist.
That made me think of another child population we work with a lot, and that has to do with the swallowing aspect for kids. We get referrals from the orthodontist who are working with the children getting their braces fit, but if they're having issues with swallowing incorrectly, then the braces are never going to work. So the orthodontist sends them to us, and we help correct their swallow pattern so that their tongue is going the way it's supposed to go, and then will not have a concern even after they get their braces off. So that's another little area we work with.
So that's a little about the speech language pathology program here. If you want some more information or you have some concerns about a parent or child, please talk to your family doctor and they can refer you over to speech pathology.